A world champion sprinter, Tori Bowie, was a force of nature on the track field. But at the age of only 32, and while she was 8 months pregnant, she apparently went into childbirth at home and died alone. Bowie's death was ruled natural, and the report stated that there had been possible complications, including respiratory distress and eclampsia. Sadly, her story is not unique. A 2022 study found that women in the U.S. face the highest rates of preventable maternal mortality when compared with women in 10 other wealthy nations. 198 deaths per 100,000 patients. That same study found that it's much worse for Black women in America. Their maternal death rates are nearly 3 times as high as those of white women. Joining us with more on this, we have Dr. Suzanne Gilberg-Lenz, who is an OBGYN in Los Angeles. Doctor, thank you so much for joining us. I do want to start with preeclampsia, and I also want to add, because I know a lot of people will be curious, that the baby did not survive as well in this. This is a very tragic story when we're talking about this woman and this athlete. Can you explain why this condition is so dangerous to the mother and clearly here the child as well?
Well, I mean, anything that's going to be dangerous to the mother is going to be dangerous to a fetus. I mean, that is where the fetus is residing. So that goes without saying, and it sort of highlights yet again why we need to be centering women's health and reproductive care of all kinds during this time. Preeclampsia is one of the more common complications we see in pregnancy, and one of the reasons that we see our patients toward the end of pregnancies more frequently. That's why we start seeing people every week, because blood pressure is the main issue here. We don't understand completely, but it has something to do with the way the placenta has implanted and the way our blood vessels are functioning during the pregnancy. We make a lot of changes to the volume of blood in our body for obvious reasons, and the blood pressure itself needs to maintain itself to a certain extent to be getting blood perfusion to all of the organs of mom, brain, heart, all the organs, and to the fetus. We get some instability and we can start having very severe problems with the blood pressure rising to a degree that becomes dangerous. And it can, if untreated, result in things like pulmonary edema, blood leaking and fluid leaking into the lungs so that you cannot breathe. And that is also related to something called eclampsia, which causes seizures and can cause death in people who are untreated. So it is shocking, horrific, tragic that in this day and age, anybody would get that sick and not be getting care. We don't know the details. I don't know what happened, but I mean, to remove the context, as you already have provided, of the insane disparity in maternal outcomes in this country would be wrong, because it's impossible for me to understand that they're not related, that her being Black is not related to this. It's concerning.
Speak to that about preeclampsia, why we're seeing those racial disparities there, and why we are overall, the other factors that are contributing to the racial disparities in these maternal mortality rates.
Well, there's the science. Okay, Boyana, there's the science, right? So we know, first of all, like I said, preeclampsia, about 5 to 8% of pregnancies can result in preeclampsia. And we know very, very well how to treat that. So when people are getting proper care and they have access to care and they are taken seriously, they shouldn't get beyond preeclampsia. They should get preeclampsia and be delivered, basically, okay? So there's the science. We do know that Black women have 60% higher rates of preeclampsia. But again, this is treatable. This should be treatable. So what is the issue? This is a great question. And we are struggling with this question, and we are struggling, more importantly, with solutions. But if you look at the data on just how the disparities that Black people and Black women specifically are subjected to, even in emergency room care, it takes longer for them to get seen. They have fewer rates of admission from the emergency room. Their complaints of pain are not taken as seriously. And consequently, a normal human reaction would be, well, I'm not taken seriously. I'm not going to go get care. So there are so many levels of problem here. And I wish I had the solution. I don't have the solution. I will say that having doctors that look like their patients is super important. We do not have enough people of color. We do not have enough Black doctors. And that makes a difference. We know outcomes are different. when we look like our doctors. This happens with women across the board also, by the way. Not here to disparage white male doctors. I have partners that are wonderful humans and doctors that are white men. However, we know the data shows us, it demonstrates. And I do have to say, as a white female physician, if we don't take personal accountability, if every person who is a healthcare provider doesn't take accountability and say, what is my unconscious bias here? Let me overdo it. Let me over attend to my patients that I know have worse outcomes. And let me look at what I can be doing differently. This is not going to get better. The organizations are trying to address it, but my experience in medicine over 26 years has been that the grassroots demands are always what makes us change.
Yeah.
I'm so personally and professionally upset about this. So I can spit the science at you and I can tell you my philosophy. I can tell you my experience. It's converging in the most horrific of ways in this loss. It's two human beings.
Yeah.
Terrible.
Yeah,
Beyond.
no, it really is. And it's getting a lot of attention. And these are very important issues that we are discussing and that need to be addressed. Dr. Gilbert-Lenz, thank you for your time today. We do appreciate it.
Thanks for having me.
Boris?